I'm Kim Skarupski at the University of Texas Medical Branch in Galveston, Texas, and this is the Faculty Factory Podcast. And I'm back with a frequent flyer, Dr. Joshua D. Hartzell. Hi, Josh.
Tim, how are you? Great to be back. Looking forward to our discussion.
Oh, you know I am as well. We were just chatting pre-record. This is going to be a good one. Let me remind you who is Dr. Josh Hartzell. He is currently the Deputy Chair of the Department of Health Professions Education at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. He has all the letters after his name: MD, MS-HPEd, FACP, FIDSA, all the education. He has devoted his life to leadership. His prior episode is number 329, all about excellent leadership. In fact, it's entitled A Comprehensive Look at Developing Excellent Leadership in Medicine. And you'll want to refer back to that episode. And we'll put it in this link too, but he has a great book that we were just chatting about. I just pulled it back off my shelf a couple weeks ago. The book is entitled A Prescription for Caring and Healthcare Leadership. He is a retired colonel in the U.S. Army. His final role in the Army was a program director for the National Capital Consortium Internal Medicine Residency Program at Walter Reed National Military Medical Center. Previous high-profile roles including being the Associate Program Director for the Internal Medicine Residency, Assistant Chief of Graduate Medical Education, Army Intern Director at Walter Reed, and the list goes on and on and on. We are talking about feedback.
Yeah, and I'm excited about this topic, Kim. I have realized over the last several months, as people have been asking about different things related to leadership and teaching, that the one topic that comes up far and away the most is feedback. And for me, it's interesting because it's not just about how do you give feedback, but it's how do we receive back more effectively, and then also how do you do this on an organizational level as well. So I think there's different layers to feedback, but boy, it seems like it's a topic that people are really trying to figure out how to do more effectively.
Yeah, and I agree with you. It's almost one of those topics that I always hear, and I'm like, well, duh, of course, feedback. Hey, you're doing great, you're doing good, keep it up. You might want to do this differently. What's the big deal? And yet it is a big deal, and it annoys me that I always think, what's a big deal about it? It is a big deal. I mean, and I always think I have these assumptions like, well, people obviously know they're doing a great job. I mean, they're obviously working here, and I smiled and gave them a thumbs up. Isn't it obvious that I, approve of this? But it's not. And in your book, in chapters 12 and 13 specifically, I have so many tape flags and things written in these chapters. I can't wait to get into it. But I annoy myself when I dismiss it and think it's just not necessary, or after someone's been around for a while, we're all good. We don't need that validation. We don't need that affirmation. And yet it is so fundamental and critical to, as you're saying, not only giving good feedback, critical feedback with the intention of helping people improve, but also making and setting that culture of inviting feedback authentically, not just saying, hey, let me know how I did, with meaning you want the people who report you to go, oh, you did great, kid. You did great, kid. No, no, not no. I insist you give me feedback. What can I do better? Because we can all do better.
I love a couple things you said there, and one for me is that feedback brings clarity, right? And what I mean by that is that when we give people feedback, it tells them that our performance is either in line with what our expectations are, or it's not in line, and then hopefully we give them some ideas to improve. But it really does clarify our expectations, and I think that's really important, because without that, it's sort of left up to people to decide, well, am I doing a good job? Which I used to think, well, if nobody tells me I'm giving giving feedback, that must be doing okay. But what I've realized is I've talked to different people about this, and some people actually think, no, I'm not doing okay. And he doesn't want to give me feedback. And I know I'm not doing okay. So I think just to let people know, hey, am I meeting the standard? Am I doing what you want? So it's really a clarifying mechanism. The other thing that I think is critically important is a lack of feedback is still feedback.
Mm.
And right, what do I mean by that? Again, going back to the point I just said, is that when I don't get feedback, some people assume it's good. And so then they just keep doing that same behavior over and over. And that may not be what we want them to do. So we really need to embrace the discomfort, which I think many of us have, of being, being able to step into that space and give people feedback. And similarly, as people who are receiving feedback, be receptive, be open, be gracious, so that it makes it easier when people are trying to give you feedback. They see it as less of a barrier, less uncomfortable, when we're gracious and accepting feedback.
No feedback is feedback. When we don't give feedback and we walk out of say, a meeting or a presentation or some, interaction without commenting on something, you said people will assume, oh, I must be doing all right. And I think also some people might assume I ain't doing all right. I'm in trouble here. Because I think what you said earlier is right. People will fill these voids with their own stories, and that story may be incorrect. So there's all these implicit assumptions that we make all the time. And it makes sense because as scientists, as physicians, that's why we're trained. We're trained to look for patterns and then skip ahead to diagnosis, treatment, cure, prevention, or discovery. Our brains kind of go that way. And then we can only go that way if we have these assumptions that we have tried and tested. And so we feel comfortable going there. And yet in relationships, these assumptions get us into so much trouble. Well, I assumed you knew. I thought you were doing a good job. And no, Josh could be like, no, I just thought I was sucking at this because I saw that look on your face. And I'm like, why would you think that? Well, I just assumed we all the time. The fundamental root of these relational breakdowns in leadership is assumptions we make about. I assumed you knew what you're doing. Well, I assumed, it's so we have to take that time, but it takes so much time, Josh, doesn't it? It just, who's got time? Nobody has time, time, time.
Well, the first thing I want to just foot stomp again to your point is that feedback brings clarity. And the other element to that that's really important that you also sort of touched on is it's not just the person we do or don't give feedback to, but it's everyone else who's observing potentially the situation. So when I give feedback, it's a cue to everyone else around that that behavior is either correct or incorrect. And similarly, if I don't give feedback, everyone else who observed me yell at that nurse might now assume that that's okay because no one gave me feedback or I didn't give my resident or fellow feedback because they yelled at them. So feedback has a huge impact on the way we interact with each other culturally. And without giving feedback, you're not providing those cultural cues as to what you want those behaviors to be within your team or organization.
Wow. Wow. Yep.
And then, to your question about time, uh, I always think about this, right? We're all busy. And trust me, I mean, when I'm on a, inpatient medicine service or ID consult service, there are times where, boy, I really would like to give this feedback, but maybe I'll give it later, or maybe I'll give it at the end of the day. So one of the things I've tried to do is just pull people aside, and even if it's a brief conversation, start that conversation on feedback, because we all know that if we wait until after rounds or the end of the day, it just gets lost, and then we forget about it, and we've never given that important feedback. So I think even if it's a brief, sort of micro moment of feedback, those can often be, incredibly impactful. There are other times where we need to step back and maybe sort of sit down and say, "Hey, Kim, we need to sit down and talk about, some of the things I've been observing." But I think for many of us, these in the moment coaching or feedback, statements that we make. I mean, we all probably have examples of when somebody else in our, professional career pulled us aside, gave us a very brief piece of feedback, and it's changed what we do. So they can be really, really powerful, and they don't have to take a lot of time. Having said that, part of this is creating this environment and culture where people are okay with that. People understand I'm going to get feedback. You know, it's part of what we do. We give each other feedback so that when I do pull you aside and have a brief conversation, maybe it doesn't feel as harsh or rushed because you know that I'm giving you that feedback because I want you to get better. which to me goes to the sort of foundational element of feedback, which is we have to build a trust between each other, right? So if I'm working with you, part of my job is to help you know that I have your best intentions in mind. And the question I'll usually ask when I'm doing talks on feedback is, what does that look like for you? Because I think it's a little different for everybody else, but how can we build trust so that you know I care about you personally and professionally? Because if you know that, it's so much easier for me to give you feedback, either positive or negative, because you're gonna know, well, he pulled me some boy, I'm not meeting the standard, but I know he's doing this for me because he wants me to meet the standard. He wants me to do well. So it really starts with that asking ourselves that question, how do I build that relationship that makes it easier to give feedback?
So, Josh, that gets to the time. I don't have time. Well, if we don't invest the time, some things up front, we will reap the repercussions, consequences downstream, and it will likely probably be a lot more time at the end game when we are having to do a performance improvement plan or have a critical conversation or someone wants to leave the team or all this conflict is happening or having to put a new job description and hire and interview because we didn't invest the time earlier. And it makes me think of just any other habit that we adopt. You said earlier, well, I'll just wait to the end of the day. We know that sometimes for some people, if we wait to the end of the day to work out, it's not going to happen. Well, I don't have time to prep my food or plan a lunch. And now the consequences are you're going to be hangry. You're going to get crappy food somewhere that's not healthy. It's going to be expensive. So there are always consequences to the choices we make. So you don't have time. I don't have time. Find time. We have to prioritize invest our time, curate our time thoughtfully and purposely to give us the results we all want. And so I think that whole you're pointing out that creating that culture is yes, this does take time and this is important. Just like planning your meal prep, your exercising, your family time, it all takes time and it's important. So how do we take that pie and deliberately carve out slices that we are going to this is who we are. Our culture is to be well, to be developed, to be seeking improvement, and I'm part of that and I'm going to model, yeah, this does take time. This is important.
Yeah, I love that point about, well, first off, problems don't magically disappear. I mean, I've had this discussion with, several people when I'm, either coaching or sort of informally coaching them, and they'll be talking about someone who they're working with and they're just not getting better. And why aren't they getting better? And, often it's because they haven't really gotten that feedback. Right. And to your point, well, if they don't get the feedback and get better, it ultimately takes more time than if you would have invested in the feedback. Right. Because once their performance rises, you don't need to help them as much. Maybe you don't have to do as much, work on the back end fixing the stuff that wasn't done correctly. So I agree. I think it's an investment. And to also emphasize the point you made of prioritizing it, we need to build this into our work schedule. So if you know that you want to give, we're talking about medical education trainees feedback, build that into your schedule somehow. Look, I'm going to try to end rounds a little bit earlier, make them a little bit shorter so that I can spend 10 minutes giving my resident or interns or medical students feedback. I'm going to set aside 15 minutes every day right after academics to pull my resident aside or my interns or students aside to give them a little bit of feedback. But by prioritizing that, it does a couple things. One is it makes sure that we actually do it, and two, it shows to them that we care enough to set aside time to do it, right? And I think that sends a very clear message to them that wow, he's actually dedicating time to do this. He must care about me. He must really want me to get better. So I think having that protected time, if you want to call it that, or designated time, sends a powerful signal to the people we work with that it's important.
And it role models, you're right. It not only builds the culture, the expectation, as you write in your book, this is, feedback is not a one-off or happens randomly. This is regular. This is part of our modus operandi. We have standardized, this is part of our faculty meetings or any kind of meetings with our learners. We build this time in on purpose. So not only is it setting this standard of expectations of this is the culture, this is how we do things around here, and it role models for colleagues and leaders and learners and patients that this is how you can do this as well. Because especially seeing that can be a sacrifice, that they know it. Your residents, they know this stuff takes time because they also have expectations on and things that they're required and obligated to do, and they know how much time this stuff takes. So training them that, yeah, these things takes time. So it's expected and you can do it as well. If I'm sacrificing and carving this time out, you can carve time to be with your peers and co-mentoring and spending time with patients. This is this is how we do things around here. You can do it as well.
Yeah, and what I love you just said there about is sort of role modeling and training others to do it. And one of the ninja moves that I like to use is, when I'm on a medicine team, I'll have the resident give the interns feedback and I'll observe it. And then I can give my feedback when they're done, agreeing or disagreeing with what they said. But then when the intern leaves, the students leave, can also give the intern or resident feedback on their feedback. So we're using that process to develop their ability at a very early stage in their careers, which I think for many of us we didn't have that opportunity. But it's you have to give the feedback anyways, and if you get the opportunity to observe them, often you have similar feedback anyways. But it's a great way to help train other people, and we'll do that with faculty sometimes as well. If we have maybe a struggling learner or a complicated situation, we'll have like an associate program director or a competency committee chair lead the feedback discussion with the trainee. We're there, and then when it's over, we debrief and we talk about how do you think that went? How do you feel like your feedback went? And then again, giving them feedback on their feedback. And it goes back to that other point you emphasize we talk about in the book is how do you build that culture of feedback? And you do that by having all these different ways of giving it, training people to do it, making it part of what you do.
Yeah. All right, Josh. Now I'm going to ask, I have um, two questions that I think are kind of challenging. And so I'm really curious how you think about this. And we talked a little bit about it. And I guess the first way is this saying, and I think it's in your book or you hearken to it, is the idea of praising publicly, but criticizing privately. So the idea that we want to create the culture of gratitude, acknowledgement, amplifying, lifting people up publicly, like kudos, good job, you're doing great, cheerleading people, and then kind of pulling people into an office and say, hey, Kim, I'd like to, give you a little feedback about that, what happened in that meeting earlier when you kind of raised your voice and kind of had body language. I'm not sure if you noticed that when you did that, Josh reacted this way, and I kind of want, so you have that you do that more privately. And so I've heard that, I know you know that kind of mantra. And doesn't that kind of contradict the idea or the philosophy of being public with everyone noticing and getting more comfortable with the kind of uncomfortable things of, hey, let's do a debrief on this meeting. Am I the only one who noticed that Kim had that crunchy look on her face and raised the volume of her and raised her eyebrow and gotten her a little snit? Am I the only one who noticed that and how uncomfortable Josh got when that happened? So how do we balance, again, find the sweet spot between rah, rah, rah in public, but criticize privately, and also having the balance of, listen, we got to take the good with the bad, the sweet, the sour, how do we balance that without stepping on people's dignity or embarrassing people? Can you talk a little bit about that dilemma?
Yeah, absolutely. And this is one of those things that comes up all the time. And often you'll hear people say that, yeah, praise in public, criticize in private, like that's how you do it, which for me was very much how I did it until I went to the Stanford Clinical Teaching Program with Kelly Skeff and Georgette Stratos. And we specifically talked about this point, which was life changing for me in terms of giving feedback. The first thing I want to say about giving praise or cheerleading, because often people think of that as like, oh, you're just, yeah, positive feedback. It's nice. Feels good. For me, this has really changed over the last couple of years. And again, I'm going to emphasize what I said earlier. Those are cultural cues as to what you want the behavior to be. So yes, it is recognizing people and valuing the work they do and that they're doing it correctly, but it's sending that very clear message of that's the behavior we want in our culture. So it has a lot more meaning than just simply giving the positive feedback. So the praise in public, criticize in private, they taught us three different things or three different areas where you really need to do it, or you should consider it doing it publicly. I also want to say that before I mention the three things, you have to ideally establish trust and create that environment where people are okay with it. Having said that, there are certain things that you have to correct publicly. So if somebody makes a racist or sexist comment or yells at a nurse, those unprofessional behaviors need to be corrected, and they need to be corrected immediately. And the reason why is that if I don't correct somebody after they've yelled at somebody or said something disrespectful, and I just pull them aside later, everyone else who's observed that interaction doesn't see me pulling that person aside. And it's unlikely that they're going to be able to go back and apologize and explain to every single person who watched it. So you have to make that spot correction for the cultural reason so that that behavior is not accepted within your culture. So that's one. So unprofessional behavior needs to be corrected. The second one is patient safety. And you could argue patient safety is first. Often I'll say that first. Uh, I can't wait to tell you if you're doing something wrong, if it's going to injure or harm the patient. Like I just have to step in. That one usually most people don't get any pushback for. I will say, I've gotten some really great advice from some of my surgical colleagues. So I am not a surgeon. I don't do a ton of procedures these days. But what they said is sometimes they'll have like code words. So instead of, me just being like, Kim, you're screwing up, or Kim, let me take over, they'll have like a code word that means, okay, I need to take over, right? So it might be that let's just say we're doing a central line together. And I'm looking at you and you're getting ready to put in the guide wire and I'm like, she's not doing it correctly. And maybe I'll say something like, uh, Kim, how's the guide wire looking? It looks a little, I don't know. And then we have some code word, but something to cue you that okay, it's time for him to take over without making the patient who potentially is awake feel uncomfortable.
Mm.
So think about code words and ask your surgeons. They probably have better ideas on examples. Um, and then so the final one that we talk about is it generalizable? So is there something that I observe a behavior and I'm like, wow, this is really generalizable. And I would love everybody to learn from this, going back to your time issue, to save time so that I don't have to teach every single person this every time I see it. I have 20 people here or I have 3 people here. If I explain this to everyone, everyone benefits from it. So I'll give you one example because this is a little different, I feel like. We spend a fair amount of time talking about how to teach and how to give effective presentations. So, an example of this might be let's say you have a resident or faculty who's giving a talk, and then maybe at the end of the talk, you say, hey, I just want to point out that something that's really important for people giving talks is wait time. And one of the things I noticed that during this talk is that there wasn't a lot of wait time between questions. And as a result, you saw that the speaker had to interject and sort of give answers or say it. So let's talk a little bit about what wait time looks like in a talk. Now, again, everybody has to, particularly the speaker. And I'm not saying I would always do this, but certainly there are situations where I might. So if it's generalizable, that's a good time as well. There are times where I agree, you should do it in private, right? If somebody is struggling and you think they're not going to pass, uh, or maybe you can already tell, like, well, this is not a good time to bring this up because they already look dejected, and they don't meet sort of the other two patient safety or professionalism issues, then you pull that person aside and talk to them about it. The last part of all of this is delivery. A lot of the reasons why it's uncomfortable is because of the delivery. So if I said to you, wow, Kim, that was a terrible talk. Let's talk about wait time in front of a group of 30 people, you would be mortified, right? Uh, but if I, said something to the effect of, thank you, Kim, that was amazing. I think everyone really enjoyed your talk. There's one piece of feedback I'm hoping the whole group could benefit from. Are you okay if I give that? Right? It's really about the way we deliver it in a kind way. And what I've sort of seen over time, and you've probably seen this, is almost everyone in medicine, and I extend this to other areas of life. Most people have really good intentions. It's just the execution. They want to do well. Like people don't show up thinking like, "Boy, I want to suck today." Right? So you don't need to pile on if their performance wasn't where you thought it needed to be. Just be kind in the delivery and tell them like, hey, I want you to get better. Here's a piece of feedback that I think might help you. So I think the part of the problem for us is we haven't always been very kind in the delivery,
Mm.
which then makes all the sort of yeah, if you're going to be unkind in the delivery, definitely do not do that in public. The other problem with that is if you're unkind and you do it in public, you're role modeling now to everyone else what feedback looks like.
Yeah.
So not only is it harmful for that individual, but it's harmful for your organization because that becomes the standard now.
Yeah. And I think the thing that's important about setting the standard is then we all know we're never going to be perfect in this. And so what I like about what you said is this is the standard, this is the expectation, being kind, thoughtful of the delivery, and then the grace comes in when there's a slip up and maybe my tone was not on point. Maybe my facial expression gave away my some true feeling. Or so when those moments when we all are not at our best or we're in the grip or we're under stress, and that we're more forgiving when we understand that that's a one-off, that's an outlier, that's not normal. And because it is so out of character, it kind of stands out, so that we know that this is the expectation is here. We level set it at this level. And I'm putting my hands to make a level. Not that people can hear me or see me doing my hands like this. We have a level. And then when someone is out of that level, you're like, oh, Josh, oh, poor Josh, he just came back. He's got that, broken leg. He's in pain, or gosh, she's stressed out. There's that little moment of grace and mercy, and so we know that that is the out of ordinary versus that's just normal behavior around here. And I always think of like when you go to a restaurant, you're like, wow, or a department store or any kind of convenience store, and people are super friendly and nice and helpful. And you're like, whoa, they're so nice and friendly and helpful and welcoming me and saying thanks. And wow, isn't this odd? No, that should be the norm, where when someone is kind of prickly or crunchy to you, you go, oh, that's strange, versus the opposite of like, well, I thought, I'm used to being treated like that. So we want to set standards that the good thing about that is then we know that I don't have to be like a soldier and perfect all the time. I'm going to mess up. But that's where that forgiveness comes, because hey, we all get it. We strive for that level.
Yeah, I was just going to say I agree completely. And a couple things that you mentioned that stood out to me. One is just the clarity of expectations. Again, what do we expect? And then this idea of why couldn't we have cultures like that are positive and reinforcing and where we feel good about going to work and we feel okay about giving each other feedback. I mean, we can build those cultures if we give each other feedback and set that as the expectation. So I think that's really important.
Yeah.
Um, yeah, we can definitely do better in many situations. The other thing I would say that you mentioned reminded me of is, when we see performance that's a little off or a little outside the norm, um, often before I jump in, I will ask the individual, like, "Hey, are you okay? Everything okay?" And then I may even say something like, "Hey, I watched this interaction. That doesn't seem like you.
Mm,
Help me understand what's going on." One of my people love Ted Lasso. I had heard years ago from a physician, Woodson Scott Jones. He said, "Be curious, not furious," or "Get
mm,
curious, not furious." And it's been a good reminder to me. And I learned this lesson. I still made this mistake as program director. Someone would bring me feedback, and I would immediately jump into, okay, I got to give that person feedback, and like, I can't believe this happened. There's always another side of the story. There's always more information. So before you really dive into the feedback, make sure you've been curious and done I like, military, done a good reconnaissance to try to figure out what is the context, what is going on, and then also just again checking in on the person to find out if there's something going on with them. Because look, maybe their parents are sick or their spouse is sick or they're sick, and you know uh, maybe, yeah. And we use this example in one of the teaching sessions that we do is, somebody shows up and they're late and they're kind of disorganized, and it's a role play, so we don't tell them. But one of the questions I ask is, you know would it change your mind if the person had just had a patient die before they showed up to rounds?
oh, of course it would.
Right? But if you don't ask that, they may not tell you, or it may come out later. And then after you've spent, 5 minutes chewing them out for being unorganized and unprofessional and unprepared for rounds, and they're like, "Yeah, I'm really sorry. Mrs. Smith passed away this morning." And then you're like, "Oh man, I feel like a jerk."
Mm.
So my initial sort of visceral response sometimes is I want to just sort of jump in and I don't want to say attack, but almost attack.
Yeah.
And what I've learned over time is I need to really pause and get curious, ask questions so that I don't make that mistake. Because your response will be completely different if there's something going on that's potentially driving that behavior.
Oh, that's a great example, Josh. I hope people heard that or replay and listen to that. That's a great scenario to work through in a workshop and have people who are like us, problem solvers, fix it, unacceptable, la 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 la, and then stop and pause at the debrief. Did anybody in their groups discover or ask, I wonder why? Tell me more. The whole coach approach of being curious. I love that. Be curious, not furious. Be curious, not furious. And Josh, you reminded me when I was training to be a coach. I'm straightforward kind of problem solver, roll the sleeves up and kind of like attack, attack, attack. And the feedback I got was, Kim, you need to slow down and be more curious and learn to ask questions. And I was like, okay. So I was practicing with my sister and I said, okay, I have to practice being curious with you. She's like, all right. I'm like, I'm curious. Why are you so stupid? And she's like, I don't think that's the way. I don't think that's what you're supposed to be doing. I'm like, oh no, but I'm curious. Yeah, that's not the curious we're talking about. But Josh, how do we wrap our heads around the idea that if we are trying to improve ourselves and we have certain expectations for myself, and I'm a type A perfectionist, and I'm always this growth mindset, and many of us in academic health, I'd say most of us are, how do we make sure that when we have maybe different generations, new people, young learners who we project that I want you to get better. I want you to improve. I'm all about developing you. That sounds good from this part of my brain. And isn't there another part of the brain maybe who goes, what? I'm not good enough as I am? You're trying to fix me? Am I broken somehow? You tell me I need to look like you, talk like you, dress like you because the way I am is not good enough? Why are you trying to improve me, make me better? Do you hear what I'm saying? I mean, I'm getting some of that and hearing some of that in my coaching that this desire to improve and to grow almost makes some people they might feel like I'm not good enough as I am. I have to change. And so I know we're neither of us is psychiatrists or psychologists, but let's pretend we are. Go.
I finished some executive coaching training last year, and which honestly was life changing for me as well. I realized that I was not a great listener, and I also realized that a lot of times my default was what they would say is being the advice monster and giving people advice rather than asking questions and getting people to come up with the answers. And almost to your question of challenging those assumptions, why do you assume that I think that you're not good enough? What's underneath that for you? Because to me that's a perception maybe that they're having, but it's not where I'm coming from. So I might explore that with them and try to get them to think about why do you feel that way, and then maybe talk through that because we have a lot of people who suffer with imposter syndrome and I'm never good enough. And you've probably seen this every time you get into a new role or new position. Well, guess what? All the stuff you thought you knew and were ready for is not enough, right? So, I think just talking through that and challenging that assumption is one way I would go. The other thing for me is it's really about role modeling and helping them understand that, the arc of our professional career, the way I look at it is it's not necessarily that you're not good enough. It's how good could you be?
Ooh.
What's your peak performance that we could get you to? Because what I'm looking at is you might be exceptional. I want to know how to take you even to the next level. Because I've yet to meet somebody, tell me if you've met somebody who's reached their full highest potential. Like they're tapped out. They're like, you know what? I'm
Done.
done. I'm
I made it. I got to the end of the Google, to the
50 years
internet. I
old
found
and
it.
I'm done, right? So to me, it's always like, what can I do to improve? And it might be improve performance, but it also might be how do I improve my personal life. It could be either. So I don't necessarily put it as you're not good enough, but how do we get you to reach your full performance? We're always moving toward that. And I try to role model that as well. Hey, look, right now, what I'm working on is listening more effectively.
Mm,
I'm working on saying no more often.
mm.
And I think it's important for us as leaders to demonstrate and role model that so that other people don't see it as a threat to their ego, but as an opportunity for growth.
Yeah,
Um,
gosh. Oh, I love that. So critical, the role modeling and creating a safe space so that people understand the intentions. And I think that comes back to your being curious of, gosh, help me understand, tell me more where this is coming from, that I'm hearing that you think I somehow like you're not good enough, that maybe I made a bad hire in bringing you here, or you don't have the knowledge, the attitude, aptitude, or the skill for being here. There's something broken with you. Tell me more about that. And affirming that this is not about your personhood or who you are as a human being. It's just our behaviors sometimes. That's the distinction here, right? So I think you nailed it, Josh. Huh.
well, you just reminded me of a quote. So I have a friend, George Ruiz, who's a cardiologist. He works at Geisinger now, but he used to give us this talk for one of our meetings at Walter Reed, and he would always say, "It's not personal; it's about personal development." Which, when I heard that, I was like, "Man, that is brilliant." Right? Because we take it very personally, but it's not really about who we are as a person. It's just about these behaviors we have, which are modifiable. Um, so I to me, that's always been key that you separate the person and the behavior. And again, almost everyone in medicine and really any profession wants to get better. So if we can deliver feedback in a sort of positive, constructive way, you know, uh, people are still going to doubt themselves. They're still going to sometimes not be happy with that. But very often, if you can show them, one, that you care, and two, that, hey, this is to help you get wherever you want to be, and that you need to have that discussion about where that is, it can often have a really positive benefit.
Yes, Dr. Hart, so rich. You're also pushing me to think of emotional intelligence and the reminder for all of us that, you know, knowledge of self to better manage ourselves and insight into others to better manage those relationships, that emotional intelligence is so fundamental to leadership. And especially as we ascend the career ladders and leadership ladders, that the feedback isn't necessarily only about you as a person, only about growing your knowledge, attitude, skills, behaviors, your way of being in the world. It's about improving your ability to manage relationships, to engage with other people. So this is the whole, what you're saying, I think, leveling up and growing awareness and broadening the lens of, oh, I see what you're saying. This feedback about self-improvement, it's not only, as your mentor said, it's not personal, it's about personal development. Personal development goes beyond your person. It's not, it's has implications way beyond you. And as you said earlier, well, how's that working out for you? I mean, then people, rightly so, in our field go, well, look at me, I'm pretty darn good. I've kind of made it to the pinnacle of society. I'm earning a good income. I'm respected. I'm a leader. Yes. And going forward, how might this behavior be affecting relationships at home with your friends, with your networks? What got you here may not get you there. Marshall Goldsmith's book. So the idea of seeing, oh, I see what you're saying, that this hard driving perfectionism, get her done mentality has worked for me well to get me here, and the awareness that I can project that onto others and assume that they have that same hard driving, get her done mentality. And maybe some of the staff in my office or in the suite, this is a job to them. Maybe they're not interested in careerism and getting promotions. And by my um, forcing my or putting my will on somebody else, that this is why I've got a lot of staff turnover. Or this is why people don't like working with me, because they feel like Kim will never be happy. She's such a perfectionist that nothing's ever good enough for her. So that awareness of, oh, I see what you mean. And now you're like, now I know what happens at home with my partner or my kids, or that I've kind of heard that before.
Well, first off, I've met you. I don't think people feel that way about you, so that's good. The a friend of mine, Dr. Rochelle Corrado, actually taught me this several years ago, and I it was a blind spot that I had, which is that I was always pushing people to the next step, the next level. And she really just raised the question you just asked, is like, what if they're happy where they're at? Not everybody is trying to necessarily move up or into a new position. Um, and a lot of that is, as you said, like a lot of people are just happy doing what they're doing. They do a great job, and that's what they want to do. There's seasons in life we have where, you know what, a new role right now is not going to fit because I'm taking care of my aging parents and I need to be there. So I think it goes back to that idea of like having that discussion about like what are your goals? What do you want to do? Because I may only give you feedback on something. I mean, there's certain things to your job I have to give you feedback on, but if there are other things that maybe don't align with your goals, uh, then we don't need to focus on those things. But that's why it's such an important discussion, and we really haven't talked about this. But feedback is meant to be a conversation.
Mm-hmm.
It is not me on one side, talking over to you with no dialogue back and forth. It is that conversation about, you know, uh, help me understand what happened. Here's what I saw. What do you think of that? Okay, here's the feedback. What do you think a plan would be? Like having that discussion and a conversation is a really, really important part of this. The last point I'll make, you mentioned something that jogged my memory about, you know, I think a lot about burnout, and Daniel Pink, who wrote the book Drive, talks about what motivates people, and people are motivated by autonomy, so having a little control of their life, decisions, schedules, those things. They're also motivated by purpose, so my work has value and meaning, and the final thing they're motivated by is mastery and excellence. So generally speaking, people want to be really good at their job, whatever that job is, right? You don't have to be a dean. You don't have to be a CEO. Like whatever your role is, they want to be good at it. They want to be known for excellence. And so I think to your point about feedback, if you can give somebody feedback to help them better at the job they want to do,
Mm.
you're in some way helping them be more motivated and less burned out because you're focusing on that area of mastery and
Yeah.
excellence.
I like that self-determination theory, those
Yep.
components. Um, it's personal. So I like what you said, Josh, that this being a leader, giving and receiving feedback is personal. And that's what you said. It's a conversation. So there's really people are listening to this podcast saying, just tell me the three things how to give feedback. How do I do it? What's the ABCs? What's the 1, 2, 3? What's the mnemonic? It's it's yes, there are many. And of course, in your book, you talk about like I love Kim Scott's, point to radical candor, her framework, 4 quadrants: ruinous empathy, manipulative insecurity, obnoxious aggression, radical candor. Um, there's certain all kinds of models and frameworks. And it comes down to just the personal relationship. And as you said, getting curious and understanding the person and their needs, their motivations, and caring about that. So setting a certain standard, making it part of the practice, making it part of the culture, making it a habit, and recognizing that you don't give feedback like a robot the same way to every person. And those of you who are listening and who have kids know that the easiest example is you don't necessarily reprimand children, each of your kids, in the same way or give the same punishments in the same way, because one kid might be like, sending me in my room, that's awful. That was the worst thing in the world. I can't play with my friends because they're an extrovert, so they're sad. You tell the other kid, go to your room, they're like, woohoo, thank you, ma'am. So it's the same, it's the recognition of we're all people. So it's personal. So I appreciate that. Reminded me that that's important.
Yeah. The other thing I would say on this is it's a skill. And to your point earlier about coaching and getting feedback is how can if you're someone who wants to be really good at feedback, and I would argue that feedback is one of the most important things we do as leaders, teachers, parents, spouses, partners. So if you want to be really good at feedback, obviously you can read books on it, you can watch videos on it, but have somebody give you feedback on your feedback.
Mm.
I mean, figure out a situation or a time where you can, have somebody observe you and then give you feedback. Or if you can't do that, you give somebody feedback, meet with a coach or somebody else and ask them like, hey, here's what happened, here's what I did, and get some coaching or feedback on your feedback. It's just such a critical skill, yet it's one of those things that we actually don't really do a lot of professional development on, which I think is why it comes up over and over as a topic that people want to talk about or think about, but you really have to practice it and get
Like anything.
feedback on it.
Like anything. Yeah. Folks, check out Dr. Hartzell's book, A Prescription for Caring in Healthcare Leadership. Josh Hartzell, you kind of piece us out. Thank you so much.
Yeah, well, again, thank you for having me on and having this discussion. Thank you for doing the podcast. I mean, it's not missed by me how much these podcasts can change people's lives. And yesterday somebody put a message on LinkedIn about a podcast I was on about a year ago and a lesson they had taken away from it. And we don't think about it, but I just want to say thank you because my guess is that thousands of people have listened to your podcast. You probably never hear from them, but they're doing things differently because of your work. So I just feel blessed to be part of that. I'm grateful for you and what you do, and hope that you continue to change lives with your work. So thank you.
Well, it's all because of people like you. Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.